Hello, good evening, everyone. Myself, Dr. Pranita Patil from Virar, Mumbai. I am your host for today. I welcome you all on behalf of Ignited Minds by PHF under mentorship of our beloved Guruji, Dr. Liaquat Namole sir. Friends, as you all know, we have started this amazing series of free Zoom webinars on Zoom from 2nd June 2022, and today is our 87th session of that series Guruji Ke Saath Guruvar. And today it's my honor to welcome an international speaker, teacher and happiness coach, Dr.Vrushali Sarswat Madam. Madam is practicing since last 24 years and she is doctor by profession and healer by choice. Madam is a founding member of Homeopathy Journal India Foundation. She is a gold medalist in PG Homeopathy, London, UK. And Madam has received many awards. So I would like to mention few of them. Uh, International Inspirational Women Award 2021, Indian Health Professional Award 2020, COVID Warrior Award 2020, Savitri Gaurav Puraskar 2019, and the list goes on and on. So she has done her paper presentation in national as well as international homeopathic journals. Madam has conducted workshops on rational parenting. She runs e-learning programs in homeopathy. Madam runs Soul Spa, Rendezvous with Self, a flagship program to enhance happiness quotient. She has conducted more than 65 international webinars in last 2 years. And she also runs social COVID awareness campaign through webinars. She also ran social COVID awareness campaign through webinars in 2020. So the list will go on and on, but I believe each one of us is very eager to learn from Madam, to hear from Madam. So without wasting much time, let's welcome Dr. Vrushali Sarswat Madam with huge round of applause. So everyone can unmute and clap. Welcome, Madam.
Welcome,
Welcome,
madam.
Shani.
Thank you. Thank you so much. Right at the onset.
See, I am, Shani always tells us, say that she listens to me, but I have been telling her that I am one of the listeners of Dr. Vrushali. Wherever she takes seminar online, I always listen to her. Though I don't come and speak there, but I am very fond of her. She's one of the teachers, contemporary teachers I am very fond of, and I learn a lot from her also. Though she is younger to me by age and by experience also, but she's very, very level-headed, and she has her own way of thinking. She has huge depth about understanding the patients. So it's. I'm also very grateful to you, Shalivita. I called her and she immediately agreed, and it's Women's Week also. It's a special launching for Vishali on our platform. So let's listen to Dr. Vishali patiently, guys, and all the queries I think she will be answering. Welcome, Vishali.
Thank you. Thank you so much. It's so kind of you to say all these words, Dr. Liaquat. It is really, really nice. And I think COVID did bring the best out of all of us. And I think out of all the systems, COVID has brought homeopathy at its very well deserving level. That we all have realized the potential of sharing homeopathic knowledge so open heartedly with all of us. So the webinars are amazing, and I'm so glad that you guys are doing it. 87 is not a small feat. Amazing. So very happy to be here, and happy to share my learnings. Whatever you guys have heard from Dr. Liaquat, I would contradict that and say that no guru, you are not a teacher. I would be saying I'm a learner, and I love sharing what I learn. So it may not be complete truth in itself. It may not be tried and tested multiple times, but every time, whatever learning I receive from every case, I feel, yaar, isko share kar lete. Somebody might be able to use it, and it will do so good to humanity. So from that perspective, I will be sharing, and I'm always open to good feedbacks. बुरा कुछ है तो नहीं बताना, अच्छा जो लगेगा वो बता देना, वो रेप्लिकेट करते जाएंगे. ठीक है. सो लेट मी जस्ट स्टार्ट. एक एक टॉपिक बहुत क्लोज है मेरे हार्ट के. आई होप इंग्लिश इज ओके ऑन दिस प्लेटफॉर्म, राइट?
Yes, ma'am.
Yes,
Yeah. Any language.
Wonderful, wonderful. So let me just start with the topic, because we have 1 hour and I want to optimize it. Okay. Is the screen full screen now or not yet?
No, ma'am,
Not
it's not full screen.
Not yet. It's going on. So let me just talk about this topic first, and I would love to look at the chat. Okay, so please be open, write in the chat, and have a conversation. मुझे स्क्रीन से बात करना बहुत अच्छा नहीं लगता है. So फटाफट जब हम ये बोलते हैं कि decoding follow-ups, तो क्या मन में आ रहा है ख्याल? क्या लगता है क्या होगा आज यहाँ पर? आई थिंक मैं स्टॉप शेयर करके फिर से एक बार ही करती हूँ. तब तक चैट में मुझे कुछ तो जवाब दे दो. कुछ प्रवचन होगा या क्या होगा? एनीथिंग?
Learning and discussion.
लर्निंग एंड डिस्कशन वो तो बोल दिया, बट जब हम होम्योपैथिकली बोलते हैं कि ना डिकोडिंग फॉलोअप को डिकोड करना है, तो क्या क्या हम एक्सपेक्ट कर सकते हैं? व्हाट आर यू गाइस एक्सपेक्टिंग फ्रॉम दिस 1 hour? फॉलोअप कैसे होना चाहिए? बेस्ड ऑन फॉलोअप, हाउ टू मूव अहेड, डोज वाइज एंड रेमेडी वाइज. वेरी गुड सुवर्णा. यस प्रीति, कैसे होना चाहिए फॉलोअप? Anything more? How to interpret follow-up? Correct. So, in my opinion, we should not interpret follow-ups. Okay? कैसे मैं बताऊंगी? जो अपने so I will I've divided the whole agenda into 3 parts. Okay, there are 5 more comments. Let me just go through. All right. So Priyanka is saying how to interpret follow-up. Vimal is saying follow-up patient का कैसे feel कर रहा after medicines. Patient कैसे feel किया after medicine. Kent's 12 observations. Yes. Vrushali, oh, there is one more Vrushali with a different spelling. Whether to continue or change medicine. Okay. Patient balance person than before. Okay. Wonderful. So interesting. See, we all are homeopaths. We should be having same idea about what to expect in follow-up, but I think we all have different. That's what individuality is. But if we want to give similar results, then this kind of individuality will not help. So for me, follow-up is more like a mathematics. ये हुआ तो वो करना चाहिए, वो हुआ तो वो करना चाहिए. Like that, it has to be set in our mind. And I'm going to attempt giving you that kind of a thought process, a process in which you can come up with your own ways and means, but the main yardstick, milestones will remain the same. So that will be my agenda of today's lecture, that at the end of it, everybody should be able to divide your follow-ups amongst 5 or 6 criteria. Okay, so we'll quickly run through philosophical background, where you should read more when you want to understand follow-ups, where how I am using it, practical demonstrations. I'm a clinical general homeopathic practitioner, right? So I will be sharing cases, and then I will be sharing where the physician's role becomes absolutely crucial in managing follow-ups. Okay, so the physician's role and everything will define. So there are, you can take a screenshot of this image and you can read into details as to what these aphorisms are. Okay, it would be, I would urge everybody that before we go to remedy and dosage or anything, we should be knowing organon very clearly, right? So from 155 to 170, 72, we should know all these aphorisms very, very clearly and understand what Hahnemann says about follow-ups. Okay, Kent came after Hahnemann and he has simplified what Hahnemann has said. Okay, having said all of that, why I chose this topic, I forgot to mention that. Because cracking the remedy is just beginning of the case. It is never the end of the case. Once you have cracked the remedy, the whole patient's journey with you will be determined exclusively on how you take the follow-up. Yeah. So that is why it is very, very, very important pillar of your practice. So three factors which are most important. First is definitely your patient. Second, you have to understand disease. So you have to have patient knowledge, you have to have disease knowledge, and then you have to have biggest knowledge as a homeopath, whatever is required. And follow-up forms a bigger chunk of this essential pillar of being a homeopath. Now, prerequisites of physician, we know all of these. I will just quickly brush through. Now, why follow-up? When do you start follow-up? Can somebody write it in the chat box? When do you start follow-up? आप लोग चैट बॉक्स से इतना वो नहीं है, फेमिलियर नहीं है. चलो कोई नहीं, we'll optimize the time then. Okay, after first prescription, Dr. Asha is saying after first prescription. Dr. Vimal is saying after giving first dose of medicine. Okay, you guys agree with this?
When patient comes next time to us.
When patient comes next time to us. Fantastic. Give me a thumbs up quickly, everybody, if you all agree to that. Thumbs up reactions में होता है, फटाफट. Something immediately, Sumita. Okay. Okay. According to me, follow-up starts in case definition. Now you will say, case definition में follow-up कैसे start हुआ? You have to set the tone of what you are going to be expecting. So you have to communicate what you're going to be expecting in this particular case to yourself. And once you know what you're curing, what you're going to figure out, you have to convey it to the patient so that he also starts expecting what to expect in follow-up. Your case definition, case analysis, susceptibility understanding, all of that starts, your follow-up has already started when you have defined the case. Immediately, it is not the second visit. It is the first visit. When you give a remedy, you have to expect what remedy response I'm going to get in this particular case. Next appointment, how are you going to schedule? So, your follow-up has already started because the kind of remedy which you are going to give that will determine when you are going to call this patient next. Now, just before we started, started the webinar, I had a child who had come with like lot of swelling in his mouth. There was the rashes from the corner of the mouth. Entire left cheek was swollen, and so much of swelling inside. Now, when I have given him a remedy, immediately the patient will say, no, when should I come? So my follow-up planning has started. My follow-up has already started. I'm already explaining it to her that it could be hand, foot, mouth, it could be this, that, whatever, and I want to see him tomorrow same time again, because I'm expecting my remedy is going to give him that kind of result, isn't it? So your follow-up doesn't start when the patient comes next time. Your follow-up starts right there in that moment. When you have that kind of an attitude, then you will be able to give good results every single time. And then definitely your follow-up will be there when the patient comes for the second visit. Okay? But all these 5 factors, they are in that particular day. First day of the patient, your follow-up will start. And when you think like that, then only your practice will also grow, because your clarity of what to expect in your follow-up will be conveyed directly to the patient. The patient will understand your confidence, your clarity, and um, he will feel from within that, yes, I want to stay with this patient. So continuity of your practice also depends on your follow-up, on your clarity of when to have follow-up. Okay. Now, follow-up there are mota moti like 12 observations are there. But what I have learned in my 24 years of practice is commonest factors. Number 1 is status quo. Number 2 is there could be amelioration. Number 3 is aggravation. 4 is your new additions. Just give me a minute. Can we hide this panel? Okay. And then there could be change in order of the symptoms, and arrested progress, or there can be a relapse. So these are moti 6 factors which are very, very essential when you are looking at follow-up, and they will be able to help you take your cases further. Okay, so let's just dive deep into the cases. For each factor, I've taken one case. So far, so good? Okay, I guess it
Yes,
is.
yes,
Let's,
yes.
yeah. All right. All right. So, how do you evaluate status quo, and what do you do when a patient comes in a status quo? Okay. So, this was a 65-year-old female patient. She had vertigo and headache. Okay. There was a lot of complications. She had a lot of diagnosis, different. There was right-sided paralysis, there was hypertension, there was depression, and she was under allopathic medication along with my medication. She just generally liked to pop a lot of medicines. This happens, she goes to this person. That happens, she goes here and there. But for a considerable period of time, she was consistent with us taking treatment for vertigo and headaches. She used to sleep whole day but would never feel refreshed. And she always complained majorly about. So, in spite of her having such different ailments, what she would complain is her size, how big she has become. She would always come and say कि कितने मोटे हो गए, देखो डॉक्टर कितने मोटे हो गए, हमारा तो पेट बढ़ रहा है, ऐसे हो रहा है. Like that she would be talking. Okay. So there were peculiar things like, and even after giving the well selected remedy, nothing was changing. So she would say relief थोड़ा है, पहले हुआ था उतना, अब ज्यादा नहीं हो रहा. So then I started asking her questions about her current last 2-3 weeks dreams. What is happening? Anything new? Any new symptom is coming up? So she has shared that there was dream of water and rivers. There was a dream of her dead sister-in-law, typically dead. So there is no sister-in-law. I've taken dead people. She she wanted to work, but she did not like working. So there was a kind of aversion to work. She was lying down full day, and especially during morning hours, she would just not feel like waking up, getting out of the bed and working. Then there was severe loss of memory. She would not even find words, and there was a very bad odor whenever she would walk in. And she would start speaking, even if it's like a 4 feet distance, still I could smell her breath. There was a lot of heaviness after breakfast, headache, sleep after, flatulence, irritations. She would be burping and loudly, continuously she would be burping. Then her dreams were disturbing, nightmare kind of dreams. And um, during sleep, sometimes siskia lete the. She would be, not crying, but like she would as if she was crying. So I repertorized, nothing concrete came out of it. Okay. So I said, what is it? What more can I do? And I was already giving her Kali carb, natrum carb, nothing was working. Many remedies have been visited because she was with me for a long time, and it had become like a circle, I'm just chasing the form, nothing is coming out of it. So then I picked up few prominent symptoms. I reviewed the case again, and then I took few symptoms, not all symptoms, but few, and in combination. So sleeplessness with vertigo in the same remedy as body ache, in the same remedy as confusion. So it narrowed down my search from 139 to now 16 remedies. Then when I to all of this with confusion, I added, she used to say, sir puzzled rehta hai. So I added only the word as puzzled. From 16, it just narrowed down my search to 5 remedies. Then to puzzled, I just added dreams of being of dead people. And again, one remedy went out. Then with that, I added irritation. So whatever was prominent in that particular follow-up, I went on adding to my search. And after adding irritations, then I added evening aggravation. Yeah. So all of that with generalities pressure amelioration, because she would literally ask her son, so she's 65, her son is 35, she would ask 35-year-old son to walk on her. So that kind of generalities pressure amelioration, when I added all of that through and through, there was just one remedy which was covering all the symptoms, and it was Thuja. Kalikar did come second, which I have given her ample, but it was not working. Then I started with Thuja BD for 2 days, and on the third day, her vertigo stopped. And the patient stopped grumbling about how her abdomen, like page kitta bad gaya hai, that complaint stopped. And son's birthday was falling in the same week, and she cooked a good meal for him. So, whatever stagnation had come in with our rightly selected remedy, Pooja cleared that. And then I did not even go back to that remedy. I continued with Thuja. Multiple doses she has required, and I've reached Thuja 10M in 3 years of treatment. Okay. And after that, also, we are still continuing. She does have some or the other complaints. It's not that completely it goes away. Paralysis, she did have one stroke. Even after that, Thuja helped her. So whenever status quo, just try and take prominent symptoms. Okay. Now the second one is what to do if new symptoms are added in this. So this was a very complicated case of 70-year-old female with she had CA colon, and she was in her terminal stages, very very bad. So allopaths had simply left her on her own. She did have anovaginal perforation. So when she came with those complaints to me, this was peak of COVID. None of the hospitals were catering to her, and the surgeon had said, "Now you just have to live with it." And she would feel very disgusted that from my vagina stools are coming out, and she would feel very, very bad. She was not able to clean that. So she was literally in tears. And then I defined her case. We gave her this remedy. Natramute 200 was given. And in 2.5 weeks, she became all right. Leukorrhea had stopped, like the perforation had stopped, but all those symptoms, it took time, 2-3 months, I think. It took time for her symptoms to come back to normalcy. She was having loose motions because of CA colon, but suddenly, after giving this medicine for 3 weeks, she started developing nausea, vomiting with constipation. So very, very typical. Her diet was minuscule, so there was no chance of any outside food or whatever. But depending on that particular totality, we had given her Nux vomica, and that helped. And we did give her palliative treatment for a good 9 months in that time. But her anovaginal perforation had completely subsided by the time she passed away. Okay, so usually it worsens, but because we were able to, had we not managed her constipation with a new remedy, the perforation would have further aggravated. So it did help. So adding a new remedy, it's okay. I mean, you can always keep changing it. Another case of new addition. So this female aged 39 was known case of hypothyroidism. 3 months, she felt completely better with silica, and her reports had come to normal, almost normal. But in some time, there was a major upheaval in the family. Her brother deceived her father, and there was a major discord. There was severe aggravation, along with a lot of addition, new addition. So you can see her PSH report, from 25, it came down to 6, and then again it went to 25. Okay, so she was coming to us in this time, July 19. Okay, so 25, say, into 3 months, we were able to bring it down to 6.29. Then, because of the dispute or whatever happened in the family, she did not come to me. She was erratic about the treatment. And then her TSH again went to 25. Okay. So from there, we have been able to bring it down to 8. And then later, it is absolutely normal now. After 21, so I don't think she even came back for treatment. Okay, so whatever new additions were there, all her generalities, the dreams unremembered, dreams of mountain, dreams of snow, all those symptoms we had taken, there was nothing which we were able to find as one remedy which can run through. So typically when I'm working with the patient, what I want is there has to be one remedy which covers all the symptoms. If I get that, then I'm good to go. Then I don't have to think about other remedies. Okay. So then I asked her what happened when that TSH jumped from 6 to again 25. So what exactly happened in that Discord? So she told me a whole lot of story as to this happened, that happened, whatever. But then I asked her, what are you feeling? I mean, I understand your brother behaved in a certain way, but what do you feel? What are you feeling about it? So she was not able to answer to that. She said, I don't know, galat ho gaya na, ye galat ho gaya, galat ho gaya. Continuously she was saying, galat ho gaya. Then I said, you know, what is your father feeling? Because father was the one who was deceived. So she says, I feel I was seeing this, and it is I am who is wrong because I raised my brother wrongly. She was the elder sister, and she said, I raised my brother wrong. I was seeing this coming, but I could not warn my father, and that's why this has happened. So delusion, imagination, wrong he has done. Now in this situation, she is feeling that she suffered wrong. She's definitely suffered wrong, but she herself has also done something wrong. So this was a very unique combination. And when I took only these three symptoms, then there was this one remedy which came Naja. Second was Salix. Third was heroin. But I have no experience with this. And then when I further analyzed with, among Salix and Naja was, there were many other symptoms. So Naja did come up because she felt one-upmanship. She felt that she was the one who fought with everything, and she should have been the one in charge of the family. That was her feeling, and the ego was kind of felt hurt. Okay. So that's why we gave her Naja. So whenever, what I understood out of this case was, whenever there is an addition of symptoms, you review the case, redefine what the state is, find out what is the cause, find out what is the effect, and then you can come to a new remedy, completely new remedy. So earlier, see, I was giving her silica. Silica is nowhere closer to Naja. But now Naja came, and that helped in the entire state. Okay. So now let's go to case 4. We have 20 minutes. All right. So arrested progress. This was a case of 49-year-old female, bipolar disorder. So depressive personality traits were also there, and her son had schizoid personality disorder traits. And it is not diagnosed, but it was my understanding that the husband also was bipolar. So the whole family was quite dysfunctional. They had a lot of disputes, fights, and a lot. It was not a very harmonious household. Okay. So in all of that, the lady would continuously feel that there is you know she she has done something bad, something. She would feel guilty that her son has landed into this particular situation, and because of son only there was so much difficulty. Okay. She would continuously go on feeling that there is a delusion, and she's the son is having delusions, and because of his delusions he's continuously behind her, and she can't get free. She would feel persecuted, and the son used to blame her, and she would in turn blame herself. So there was a lot of sadness. There was uh, a feeling that she has done something wrong. She has done something bad. She has neglected her duty towards the son. Okay. So she did lack confidence. She felt she committed a crime. So there was lot of things. She's doomed. It is not going to get better. She will continuously have trouble. All of those symptoms. So when she came with an arrested progress, that there was no further improvement in her state. Like one fight and everything will go back to the same state. So there was no progress, right? So I defined the case. First time I had given her cyclamen. So that those symptoms were from the first case definition. Okay, 2-3 months I gave her cyclamen 200 and nothing happened. Then I again asked her same questions, and again she's saying that it is to baba mala tras deto. She's talking about her son. Ki to baba mala continuous tras deto. The son is continuously giving me trouble. He's only born because everybody is going to give me trouble. I have to get troubled, and that's why I'm born. So that was her continuous state of being persecuted, state of being that everybody is persecuting her. That was her continuous state. Okay. So again, when I put that, cyclamen is the only remedy which is again covering everything. Carcinogen was also there, but the kind of irritation and the kind of disturbed mentality this lady had, only cyclamen was fitting. So I had no doubts about my remedy. So, when there is arrested progress, what you are supposed to do is review, see if same remedy, same state is coming. Then if the patient is at the same level, then you keep the same potency. If the patient has gone at a different level, if it is heightened, then you change your potency or maybe try repetition. But you check if it is the same remedy, then you don't do anything. You just simply give higher potency or give more repetition. Sometimes it is just not going to work with 1 or 2 doses. Repeatedly, they will require doses. So give it. If the state is different or it is upgraded, your understanding has to be upgraded in that case, because sometimes the similar remedy will give you result to a certain level, and it will, like onion, how it unwraps itself, dried onion ke niche, you'll get wet onion, like that. You're removing the version which the patient has created for herself for so long. So then you remove that wrapper, underneath you will find a real version of that patient, the original version. So then you start treating that. So when you have an upgraded understanding, then you find a new remedy, and then a new remedy will call for absolutely new planning. You will have to figure out how much is the duration of the remedy, how much to repeat, what to do. So this will be completely new planning. But if it is the same state, like in this case, arrested progress, same case, same story, same understanding, you jump up. You give bigger, like higher potency. Okay. So that was about arrested progress. Now, what do you do when you have an aggravation? An aggravation, mind you, yeah, no matter what you do for that particular case, the moment you have one aggravation, the entire family will leave you. So you have to be very, very cautious when you have aggravation, when patients come in a state of aggravation. And like in this case, this was a case, the father had come with detailed, he was very, very detailed. This is I think this is a 10-year-old female child. Okay. So this girl had hypothyroidism, and nowadays we are getting a lot of young hypothyroidism patients. Earlier it was not the case, but now it is a lot. So this 10-year-old girl was diagnosed with hypothyroidism. When she came, her TSH level was 58.28. We started the treatment. It started going down. I was very happy. At the end of a month or so, it was 44.30. Then, slowly, somebody has unmuted themselves. Can they mute? Okay. And then suddenly, she came with a huge aggravation. Okay. So let me go to the story, because whenever the patient comes with an aggravation, what do? You find out, you ask them, what is the story of this aggravation? So not always necessarily that your remedy is giving aggravation. So homeopathic aggravation, it's very easy and fancy for people to stamp it. Homeopathic aggravation ho gaya. Whenever you take homeopathy, you aggravate your symptoms. So no, that is an image which we homeopaths have to break. That not every time, you will never get aggravation every single time. And homeopathic aggravation is a completely different thing, wherein the patient actually feels better but has more symptoms. So that is not something which is going to be a big bother, or it is not a negative thing. That's a good thing which we have as a homeopath. It's like a yardstick. It's like a confirmation of your medicine being good. So let's not malign homeopathy with saying homeopathic aggravation ho jata hai every time. So this was not a homeopathic aggravation. This was, so every time my point here is, every time the patient comes to you in aggravation, you sit down and ask, review the whole case, understand what happened, where did it go wrong, why is the symptom coming? Okay. So 10-year-old female, she was going through menarche, was diagnosed with hypothyroidism. So any which way the system was erratic. In all of that erraticity, in all of that discomfort, what happened is there was a huge breakup in the friends group. So there was this girl used to go down for swimming, and the whole group was completely broken up. There was a big fight, and then one of the girl who was like a leader of that group, she shifted to another building, and then some girls remained close to that particular building, and then some girls shifted with her to that another pool because that was a bigger building. So they said, "Hum yahan nahi khelenge, hum wahan khelenge." And there was a big politics, mean girl scenario going on. It was too much turmoil in this poor girl's child. So what was I doing? I was chasing the form. I was trying to understand disappointment, this, that. Many remedies were given. Now what to do? What to do when you have so much things? So what I did was I had understood the whole personality type and the story. Even when she was diagnosed with hypothyroidism, that time also there was disappointment. Now also there is disappointment. So my remedy, I was very clear about. So I simply allowed it to die down. I simply allowed the aggravation to go and help me with the form. So I just waited and just watched, gave nothing. So what you see, this shift from 109 to 16, it simply came out of placebo. Whatever remedy I had given, that was acting, and this turmoil had given just a spike. So it took me a while to understand that I should not fiddle with this whole system into hyper mode. So I just waited. So most important lesson which I learned was, whenever you have aggravations, just wait. Just wait. Do nothing. And let the aggravation tell you which way you want to go. So whatever remedies I had given, 2, 3 remedies I must have given, I stopped. And then it just subsided, and slowly the TSH started going down. Okay. Now, in case of amelioration, so what are you going to do? It was a simple case of amelioration wherein the patient had lot of pain. This was a man having lot of pain, stitching pain, extending down the ureter. And every time he was having urination, he was feeling better. After also, and before also, during also. So the moment urine passes down the ureter, he would feel better. Okay. And typically afternoon aggravation he had. So simple lycopodium, it was through and through like a book picture of lycopodium. I had given him 1 dose. And in the evening itself, he called me. Morning, I had given him 1 dose of lycopodium, and I had given him a couple of doses to have as a stock. And I was thinking maybe I will have to go step up the potency or what, I don't know. I was not sure how he is going to respond. So I had asked him to give me a call, and he calls me in the evening immediately. Doctor, 4 hours, I'm absolutely fine. There is no pain at all. What do you do in such a case? You had given some doses as to, a planning that you can take it in future. But no, you simply stop. You don't go and don't repeat the doses. So whenever there is an amelioration which is already set in, allow your body to heal on its own. Don't repeat the medicines. Okay. Now, overall objective of the physician I've taken. So, follow-ups, so many times we tend to miss on follow-ups because we don't realize what are we curing, what to cure in the case. Then what is curative? So what is curative in our remedy? So that we'll have to have a clarity on. And most importantly, what is the patient's issue? Why is the patient coming to us? What is the gain in pain for the patient? So because patient's issue, if you don't understand, then you will not be able to figure out what to expect in follow-up. And what are the patient's strength? What is patient's gain in pain? So that has to be the objective. The whole objective of the physician has to be what to cure, what is curative, what is patient's issue, what are patient's strength, and what are patients gain in pain. Once you understand that, then our process is very, very easy. It is very simple. You receive the patient, you explore further, First, you receive what the patient wants, you explore further, and then you simply explore by nudging the patient. Then you go into confirmatory exploration. So when you are exploring, you take down all the symptoms, you take down the rubrics, you find out. Then you go on confirming. So once you come to lycopodium, then you can always go on confirmatory exploration. You can go on asking the patient whether your the remedy which you're thinking about, those symptoms you can ask. And it's like I always share it with my patients कि हम ना homeopathic कुंडली बनाते हैं आपकी. So when I know a certain part of you, I will know so much which you are not actually telling me. So that confirmatory exploration always works like a magic, and the patient is in awe कि डॉक्टर को इतना सब कैसे पता चल गया. So that you have to do with each and every patient. So do's and don'ts, there will be some do's and don'ts. Allow free expressions, observe facial expressions definitely, and listen. A lot of times we are in a rush. We don't listen to what exactly the patient is saying. So if you go back to that case of the lady with vertigo, what she was more concerned was about her size. I was not listening to that in the initial part, right? So had I listened to her that the body is big, Thuja has that kind of delusions, right? I could have landed on Thuja earlier, but I was not listening. So listening is very, very important, and being unprejudiced, everybody talks about it. I'm not going to talk about it. What are the don'ts of every case? No interruptions. Allow free flow. When you allow the patient to speak without interruptions, they can tell you way more than what you will ask them. Either or questioning नहीं करो. ऐसा होता है कि वैसा होता है नहीं करो. Give them open-ended questions. And premature conclusions nahi karo. Don't decide, don't conclude, don't interrupt. Somebody has said what? Interpretations. Don't come to interpretations. Don't. You just understand. Jaisa bola hai, vaisa lo. We are just translators. We cannot add our own version to it, right? Translators का काम क्या होता है कि ये भाषा से वो भाषा में डालना है. तो पेशेंट की भाषा को रेपर्टरी की भाषा में डालना है. हमने और कुछ भी अपना ऐड नहीं करना है. When we do that, then we are, we can succeed. So as a physician, unprejudiced observer होना जरूरी है. So that will be like my last 2 minutes. You have to be confident about self as well as of the system. Okay. You have to be an unprejudiced observer, being confident of self and the system. What more do you need? You need to develop skill set. अब skill set किस चीजों का चाहिए आपको? Diagnostic skill set चाहिए, person understanding का skill set चाहिए, and definitely materia medica रह गया है, but materia medica का भी skill set आपको चाहिए. फिर आपको eternal learner होना पड़ेगा. Learner किन चीजों का होना है? What are the new developments? What are the new things which are coming around? You have to also know and value the old literature. And definitely embrace technology. Chat GPT पढ़ के patients आके पूछ रहे हैं कि मैम ये हो रहा है, ये वाला मेडिसिन ले लूं क्या? Chat GPT बता रहा है ये मेडिसिन ले लो करके. So you have to be, completely on top of technology. Then lastly and most importantly, what you need is you must follow Hahnemann. Because how do you follow Hahnemann? You imbibe his qualities. You think how Hahnemann would have thought about a certain problem. You learn to struggle like how Hahnemann struggled all the time. And you find out you have a solution-oriented practice. You do not just become a general practitioner, like, an earning member for your family. Don't become that. You become a solution provider for the community. You pick up a problem which is close to your heart and you become a solution provider for that problem, contribute to the society, and then nothing can stop you from growing your practice. So with that, I think I'll come to a conclusion. These are my email IDs and Insta handles and things like that. You can always get in touch with me. I know 1 hour is too short a time, but I hope I did enough justice to the topic. But if you have more questions, I'm sure you guys will have more questions. So I would be very, very happy if you can write to me on this. And I again want to thank Dr. Liaquat for doing such an amazing work and the entire team for organizing these kind of talks, webinars, and giving me an opportunity to come and share with you all. Thank you so much. Really, really grateful. Yes, Pranita, there are one or two questions.
Yes.
Yeah.
So we take
Okay.
questions first.
Go
How
ahead.
long we should wait for the action of the remedy?
So, there is this beautiful book, Boric. He has a list of, so digital world has actually, nowadays everybody is reading digitally, right? So you don't go through the whole book. आप search डाल देते हो, जो पढ़ना वो पढ़ लेते हो, right? But I would urge everybody to at least buy a couple of books, physical copies, because when you flip through physical copies, you will learn so much. Boric has a chart at the end which talks about number of days. Every remedy has an action of for a certain number of days. So if you go through that chart, you will get your answer. You have to wait that many number of days till the time that remedy is acting before repeating the second time. Again, that is one answer. Second answer is your patient will be telling you when the remedy, even if you don't read that, you don't go to Boric, then your patient will also be able to tell you, because whenever you give a dose, the patient will feel an amelioration till a certain period. When his symptoms again starts emerging, that is the time you decide that now I want to give second dose. Right? So patient will definitely teach you.
Yeah. True. Anyone else? Anybody wants to ask anything? Hello?
Hello.
Yes. Yes, ma'am.
Good evening, ma'am. I want to ask ma'am regarding removal of miasmatic block. How to remove the miasmatic block in follow-up cases?
Very, very good question. Excellent question, actually. Removal of miasmatic block. So I have come to an understanding that you have to find out a remedy which covers the miasm. The more you go towards that thought process, then you don't have to, give separate remedy for removing miasmatic block. Then the level of cure which you will experience is superb, superb. You will not have relapses. You will not have to repeat too many doses. So take an extra effort wherein, the remedy which you are giving is also covering the miasmatic block. I used to practice that way, that you give one constitutional and then you give something else to remove the miasmatic block and things like that. But if I've learned something in my last 24 years of practice, this is one of the most important, biggest lesson. Last 7-8 years, I have started giving only the remedy which covers that particular miasm. Does it answer your question, Asha?
Ma'am, but in my practice, I found some patient after giving after removal of miasmatic block, uh, some patient came with the recurrent symptoms. Then in that case, can we repeat the same medicine which
I'm
which
not
we had
trying.
used
I'm
for
not I'm not
removal?
getting your question.
Um, Ma'am, for removal of miasmatic block, if we choose a medicine, after after giving repeated constitutional medicine, if the symptoms recur, and if I'm giving the the medicine for removal of miasmatic block, but after some follow-up, again patient came with the same symptom, then what to do?
That's what I'm trying to tell you, that then you must find a remedy which is covering all of those symptoms, even your miasmatic block. Then your remedy selection is not up to the mark. You don't,
Okay.
one person, one remedy is what is needed. I used to do that kind of a practice earlier, I told you. Before 2015, I used to give one remedy, one constitutional, then another anti-miasmatic remedy, then maybe an acute remedy. But what I've seen in after stopping that method is when you give a remedy which covers entire person, all the problems. So let me ask you another question. Does all your patient, do all of them have and like a miasmatic block? Yes, Asha?
Yes, ma'am. Yes.
All your patients have miasmatic block?
No, not
Only few,
not
right?
every patient. Yes.
Only a few. So that itself becomes such an individuality for that particular patient. So that should be a part of your totality. Your miasmatic block has to be a part of your totality, and you must find a remedy which will cover that particular miasmatic block, what you are calling it as. So miasm has to be a big part of your remedy selection. Do you get my point now?
Got it. Yes.
Try karo and let me know how your practice changes after you incorporate miasm in regular prescription.
Sure, ma'am. I will contact you.
Definitely. All right.
Can I say something, Vrushali, about Dr. Aisha's question?
Yes, sure, sir.
Dr. Aisha asks, see what happens many times. We do not look at the remedy which is closer to that. Okay, supposing that you have given natrum mur. Many times it is that the remedy that the patient requires natrum silicata or natrum carb, a closer what you call molecule. Or many times, like if you have given let's say Naxomica, it can be other remedy from the same family. Like many times we see that we give Pulsatilla many times, but the patient is actually a Thuja patient. Okay, so it is like that. So you have to look in the same family, a remedy which is closer by. हम लोग उसको सौतेली बहन ऐसा बोलते हैं. सौतेला भाई सौतेली बहन की तरफ ध्यान दो थोड़ा सा. Okay, so it is a
मैं
partial
क्विकली
similar.
केस शेयर करती हूँ सर, आपका जो पॉइंट है वो एक्सप्लेन करने के लिए
Yes,
केस
yes.
बताती हूँ.
Please,
तो
please, yeah.
आई हैव अ पेशेंट, हाइएटस हर्निया का पेशेंट है, एंड उसको हम ना काफी टाइम से दे रहे हैं नेट्रोम्यूर. तो एक कुछ लेवल तक ही आया रिलीफ उसमें. उसको एक बारी मैंने अपॉइंटमेंट दिया था 9 o'clock मॉर्निंग का, एंड आई रीच्ड क्लिनिक एट 9:05 एंड ही वाज सो अपसेट विथ मी कि ना आपने, अगर आपने 9 o'clock का टाइम दिया, आपको 9 o'clock आ जाना चाहिए था ना. हाउ कैन यू कम सो लेट? एंड देन आई आस्क्ड हिज वाइफ कि हमेशा ऐसे रहता है. तो देन शी वेंट ऑन टेलिंग मी सो मेनी थिंग्स अबाउट हिज fastidiousness with time and fastidiousness otherwise. So that day I changed his prescription and his hiatus hernia is completely reversed. So from natrum muriaticum I just shifted to natrum arsenic, and it's a world of difference. So what your sir is saying is correct. आप सौतेली बहन ढूंढो. That's a very good term.
Thank you. Thank you so much for this important trick, sir. Sauteli Bahan.
Lovely.
Okay, thank you. This has been fantastic. Pranita, you can, anybody has any questions for madam? Guys? Okay, I think we'll call Dr. Vrushali again very soon once she has time. Pranita?
Yes, sir. Thank you so much, madam, for such an informative session, for showing different shades of follow. So it was really very nice session. And thank you everyone for joining. Thank you, sir, for always giving one-liner or such tips. You know, हम हमेशा बोलते हैं कि cherry on a cake. So no matter how the session ends, it comes at the end and he has something amazing to share. So thank you so much, sir. And this is Sir's specialty, how he teaches us compound prescription even in the courses. This we have learned from Sir, and this is really helping us in the practice. So thank you so much, Sir. We are always grateful to you, and thank you, Madam, for such an informative session. Thank you everyone for joining. And thank you, Team PHF. Thank you.
Thank you, madam.
Thank you, Vrushali. Bye-bye.